My name is Ashlie and I'm with Old Family Medicine of Carmel, and today we're going to talk about insulin resistance. So insulin resistance is the first stage along a continuum of insulin dysfunction. It begins down here with insulin resistance and it ends over here with uncontrolled diabetes. And when you're in the insulin resistance phase, essentially you're in a phase where your body cannot effectively use insulin. So it has to make more insulin to get the same job done. So I would use an analogy of a car with gasoline. If you have a very efficient car, you can get 22 to 25 miles out of every gallon of gasoline. If you have an inefficient car, you might get 15 miles to the gallon of gasoline. Either way, the goal is to get to your destination, and you may get there with less gas if you have an efficient car, or more gas if you have an inefficient car. And it's very similar with insulin. If your body is insulin resistant, you will have to use a whole lot more insulin to get the same job done. And that job would be controlling your blood sugar. So your body will continue to make as much insulin as it needs to keep your sugar controlled until it just runs out of insulin. Your insulin is made in cells in your pancreas called beta cells. And beta cells can tire out. So over time, you lose more and more beta cells, and eventually you just can't make insulin anymore. When you get to that stage, you are in the diabetes phase. Many times you've been insulin resistant for years before we know, because we can't always detect insulin resistance on blood work. We can detect pre-diabetes on blood work, which is sort of the next stage in insulin dysfunction. So by the time somebody's pre-diabetic, they start showing blood sugar abnormalities, and we find those on blood work. If you're just insulin resistant, you may be making a whole lot of insulin, but it's still controlling your sugar. By the time you're pre-diabetic, you actually have blood sugar abnormalities. And we can find that on blood work by seeing a fasting blood glucose that's over 100, but under 126. And normally we want to see that on more than one occasion. And we can see that by checking a hemoglobin A1C test, which is a test that tells me how your blood sugar has been doing over a 90-day period. It kind of gives more of an umbrella or bird's eye view of your blood sugar. And if that test is over 5.7 but under 6.4, you're officially in the pre-diabetes phase. So insulin resistance and pre-diabetes are actually two different stages along the same continuum. So there are several factors for developing insulin resistance, with the most common one being overweight or obesity. As your body gains excess fat, and in particular abdominal fat, you will start to become insulin resistant. Abdominal fat really comes in two types. There's subcutaneous fat and there's visceral fat. And the visceral fat's the kind you can't see. It's kind of sneaky. It collects around the organs inside your body, and even thin people externally can have a lot of visceral fat, which is why you sometimes see thin people who are diabetic. But visceral fat's very inflammatory and it's anti-insulinogenic. And all body fat really is anti-insulinogenic, but visceral fat in particular. And so the more body fat you have, the more overweight you are, particularly the more abdominal fat you have, the less likely your insulin is to work effectively. So that's the main risk factor for diabetes. But there are other risk factors too. Family history is a big one. Genetics play a big role. Pancreatic disease, if you have any type of pancreatic process that is killing off your beta cells, you'll have trouble producing insulin. And then you can have historical risk factors. If you are a woman with PCOS, insulin resistance is an integral part of the PCOS syndrome, as is gestational diabetes. Gestational diabetes sort of gives you a window into the future function of your insulin. So if you're diabetic when you're pregnant, there is a 1 in 2 risk that you'll be diabetic later in life. Insulin resistance can be kind of tricky because there are often no obvious signs or symptoms. Many times we don't find insulin resistance until somebody comes in for screening blood work and we see an abnormal sugar. But there can be some signs. Fatigue is a big one. When you can't use your insulin appropriately to control your sugar, you can't use that sugar for fuel. And so you end up feeling fatigued. But fatigue is so nonspecific, it can be a bunch of things. By the time people start having sugar abnormalities, you'll see lots of signs. You can have recurring yeast infections. Sugar cravings will go up. The more insulin you have floating around your bloodstream, the more you crave sugar because that insulin is sitting there waiting to take that sugar out of your bloodstream. So people tend to crave sugar more. And that can be sort of a negative snowball effect. If you have excess body weight, which produces excess insulin, and then that excess insulin causes sugar cravings, which makes you want to eat more sugar, which will then increase body weight, and it just becomes this snowball effect. So it can sort of be a self-perpetuating problem. Some other things that might come up with insulin resistance would be reoccurring yeast infections, are common. Maybe tingling in the hands and fingers, sometimes blurry vision. But honestly, most of those symptoms don't occur until you've already had some sugar abnormalities. So if you're in the very early stages of insulin resistance, the only thing you may notice is that you have some excess abdominal weight gain that you just can't get rid of. That's the most common thing I see. So as a direct primary care physician, I can spend somewhere between 60 and 90 minutes with my patients that have newly diagnosed insulin resistance and really educate on what to do for exercise, how much exercise to do, how to fit it into their day. One of the biggest problems people have is figuring out when they're going to work out. And what a lot of people don't know is that you can get the same benefits from 3 10-minute bouts of exercise throughout your day as you can from a full 30-minute session all at one time. So I can help work with them to figure out where do you have 10 free minutes to get a quick walk in and accumulate 30 minutes throughout the day. And then I also have time, and I think the most important part and what takes the most time is educating people on what's a carbohydrate, where are they hiding. Carbohydrates hide in foods everywhere because we have so much processed food now. And not only how can you get it out of your diet, but then what can you eat in its place? One of the biggest questions I get is, I know what I'm not supposed to eat. What the heck am I supposed to eat? And so I usually have patients keep a food diary and an exercise diary for a week or two before they come in, and then we can go through that with a fine-tooth comb and really figure out what they're doing right, what they need to eliminate, and what we can substitute. We read food labels, we do carb counting. I can help them figure out with simple math how many grams of carbs they can have per day. For a low-carb diet, I don't like to do no-carb diets, but low-carb I think is good for insulin resistance. And then we do frequent weigh-ins. And because there's no limit on the appointments you can have in a DPC practice, I have some patients that come in weekly and they just want to be weighed. And they feel that it helps them keep them accountable if they know that someone's going to be looking at it and writing it down. I have some patients that come in monthly because it helps them keep, that 30-day goal in mind. I think it helps them get out of bed and exercise when they know they're going to have to come in the doctor's office and weigh. So it allows me to manage lifestyle factors and insulin resistance in real time, rather than saying, cut the carbs out, work out more, I'll see you in 3 months. I can make it much more personal and manage things much more real time. Again, I'm Ashlie Old of Old Family Medicine of Carmel, and if you have insulin resistance or you feel you may have insulin resistance, please come and see me. I would love to help you either make the diagnosis or create a treatment plan that will help you move on with a healthier life.